Now, the total number of COVID-19 cases registered worldwide passed the 300 million mark. This comes as Omicron variant is spreading rapidly. Now, the Omicron variant feels like deja vu, masks at all times, staying indoors, some version of the government restrictions. The new wave of the pandemic had its first effect on the healthcare system this time. United Kingdom's National Health Service is feeling the mounting pressure. In London, military personnel have been deployed to support hospitals. In the winter season, hospital usually witnesses a rise in hospitalizations. So the Omicron case has put hospitals on a war footing. Over 120,000 NHS staffers were off work with COVID.
I'm a GP. I've never known it this bad. We are having to literally contact patients without notice, saying that the staff member, a doctor or nurse, just isn't in today because they're self-isolating. This is not normal. And therefore, the government does need to recognise this is clearly an NHS under extreme pressure, and the living reality, sadly, for thousands of patients is they're experiencing the suffering, the consequences of such pressures and also staff absence.
On the first day of term after Christmas in England, more than a third of schools had over 10% of their staff absent because they are down with COVID-19 infection. On to Germany now, where maritime state of Bremen has the country's highest vaccination rate. But in the latest wave, it has become the hardest hit because of Omicron. The 7-day infection rate in the region stood at 800 cases per 100,000 residents. This is more than double the national rate, which is 303. Coming to Australia, the country's most populous state could peak by the end of January. This is what is being predicted by officials. Authorities have reinstated some restrictions to curb the fresh spike. Daily cases in New South Wales shot up to over 38,000, exceeding the previous pandemic high of 35,000.
This is a challenging time, not just in New South Wales but around the world, but the efforts that our people have made has kept New South Wales safe, has kept New South Wales open and kept New South Wales strong.
Xi'an, that is a city of 13 million in northwest China, entered its 16th day of lockdown. Residents have complained about curtailed access to food and medical care. The story of a pregnant woman who lost her unborn baby after waiting outside a local hospital for 2 hours provoked anger. The government claims that the city officials have been punished. The Health Commission has also apologized now. And Japan has approved new restrictions to control the Omicron spread. The new measures include earlier closing hours for restaurants, a ban on serving alcohol, and restrictions on large-scale events. The restrictions are going to last through the end of the month. And Brazilians with COVID-19 symptoms are facing long lines to get tested. This due to a lack of kits. Brazil has failed to implement any testing strategy from the very start of the pandemic in 2020. And to make matters worse, some of the health ministry's databases have been offline since a hacker attack on the 10th of December. Despite having the world's third deadliest outbreak, the government has still not been able to fix the error even after 28 days. Now, the United States is witnessing a new pandemic trend. The hospitalizations of children is soaring to a record high. Last week, over 600 children were admitted to the hospital with COVID-19 each day. According to data from the Centers for Disease Control and Prevention, last week's numbers are more than double the average of the week before. Cases among children have also risen to record levels. Data suggests that over 300,000 new COVID cases were detected in children during the last week of December, which is up by 64% from the week before. Experts and officials believe that these two trends are likely linked, and the rise in hospitalizations is the unfortunate outcome of more children contracting the virus. And there are several drivers behind the soaring pediatric cases as well. Early data suggests that Omicron could be up to 3 times more infectious than the Delta variant. And children are the least vaccinated group in the United States. Children under the age of 5 are not eligible for a vaccination at all. and teens aged between 12 to 15 only just became eligible for booster shots in America. WION is now available in your country. Download the app now. Get all the news on the move.